Understanding core medical mechanisms is essential for effective clinical practice. Recognizing key clinical presentations allows healthcare professionals to identify patterns and symptoms that may indicate specific diseases or conditions. By linking these presentations to their underlying pathophysiology, clinicians can better interpret diagnostic findings and choose appropriate treatments. This approach not only enhances patient care, but also deepens our comprehension of how the body responds to illness. Ultimately, mastering these connections forms the foundation of accurate diagnosis and management in medicine. Myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart muscle is blocked, leading to tissue damage. The classic symptoms include a crushing chest pain that often radiates to the left arm or jaw. Patients may also experience associated features such as intense sweating, known as diaphoresis, and nausea. These signs are important indicators of a possible heart attack and warrant immediate medical attention. Recognizing these symptoms can be crucial for prompt diagnosis and treatment. Myocardial infarction, commonly known as a heart attack, occurs when blood flow to a portion of the heart muscle is suddenly blocked. This process often begins with the rupture of an atherosclerotic plaque within a coronary artery. The exposed plaque triggers the formation of a blood clot, or thrombus, which can rapidly grow and obstruct the vessel. Acute coronary occlusion deprives the heart tissue of oxygen and nutrients, leading to cellular injury and, if not promptly treated, irreversible damage. Understanding these mechanisms is crucial for recognizing the urgency and guiding effective treatment strategies. ST elevation myocardial infarction, or STEMI, and non-ST elevation myocardial infarction, known as NSTEMI, are two distinct types of heart attacks. The primary difference lies in the changes observed on an electrocardiogram. ST-EMI is characterized by a significant elevation of the ST segment, indicating a complete blockage of a coronary artery and extensive heart muscle damage. In contrast, NSTEMI does not show ST segment elevation, suggesting a partial blockage and less extensive ischemia. Recognizing these differences is crucial, as they guide immediate treatment strategies and influence patient outcomes. The extent of ischemia and the presence or absence of ST changes help clinicians determine the urgency and type of intervention required. Cardiac biomarkers play a crucial role in diagnosing myocardial infarction, as they indicate damage to the heart muscle. Among these biomarkers, troponin stands out as the most specific and sensitive indicator of cardiac injury. Troponin levels begin to rise early, often within a few hours after the onset of myocardial infarction, making it invaluable for prompt diagnosis. Its specificity helps distinguish cardiac events from other causes of chest pain, guiding timely and appropriate treatment. The early detection of elevated troponin can significantly improve patient outcomes by facilitating rapid medical intervention. In the management of acute myocardial infarction, therapeutic strategies are designed to reduce mortality and prevent further cardiac damage. Beta blockers play a crucial role by decreasing heart rate and workload, which has been shown to significantly lower mortality rates in affected patients. Aspirin, another cornerstone of therapy, exerts its antiplatelet effects through the inhibition of the COX-1 enzyme, thereby reducing the risk of clot formation. Together, these interventions form the foundation of acute care, improving patient outcomes and enhancing survival rates. Upper motor neuron lesions are characterized by several distinct features. One of the primary signs is spastic paralysis, which results in increased muscle tone and stiffness. Hyperreflexia, or exaggerated reflex responses, is commonly observed due to the loss of inhibitory control from the brain. Another hallmark is the presence of a positive Babinski sign, where stroking the sole of the foot causes the big toe to extend upward. These symptoms help differentiate upper motor neuron lesions from other types of neurological disorders. Lower motor neuron lesions are distinguished by a specific set of clinical features. Patients typically experience flaccid paralysis, meaning the affected muscles lose their tone and become limp. Hyperreflexia, or decreased reflex responses, is also commonly observed. Fasciculations, which are involuntary muscle twitches, may be present and often indicate ongoing nerve damage. Over time, muscle atrophy develops as the muscles waste away due to lack of stimulation. Neurological deficits can often be localized based on the vascular territory affected. Strokes involving the middle cerebral artery typically result in weakness or sensory loss in the face and upper limbs due to the artery's supply to these regions of the motor and sensory cortex. Additionally, the concept of hemispheric dominance plays a crucial role in language function. In most individuals, the left hemisphere is dominant for language, so strokes in this area can lead to aphasia, a disorder characterized by impaired speech and comprehension. Recognizing these patterns is essential for accurate diagnosis and targeted treatment. Lesion localization is a fundamental principle in neurology, helping clinicians determine where damage has occurred within the nervous system. For lesions situated above the point where nerve fibers cross, known as the decussation, symptoms typically appear on the side opposite to the lesion. This contralateral presentation is due to the crossing of motor and sensory pathways within the brainstem or spinal cord. Understanding this relationship allows for more precise diagnosis and targeted treatment strategies. Recognizing whether deficits are contralateral or ipsilateral is crucial in mapping neurological disorders. Staphylococcus aureus is a well-known microbiology buzzword, often described as a gram-positive cocci, that appears in clusters under the microscope. It is distinguished by being both catalase and coagulase positive, which helps differentiate it from other staphylococcal species. Clinically, Staphylococcus aureus is associated with a range of infections, including skin abscesses, pneumonia, endocarditis, and osteomyelitis. Its ability to cause diverse and serious conditions makes it a significant pathogen in both hospital and community settings. Mycobacterium tuberculosis is distinguished by several key features. One of the most notable is its acid fastness, which results from the presence of mycolic acids in its cell wall. These waxy lipids make the bacterium resistant to decolorization by acids during staining procedures. Another hallmark is the formation of caseating granulomas, which are organized clusters of immune cells with a central area of necrosis. These granulomas are a characteristic tissue response to infection and play a central role in the disease process. In microbiology, certain patterns emerge that help explain how organisms interact with the human body. Encapsulated bacteria possess a protective layer, allowing them to evade phagocytosis by immune cells and persist within the host. Additionally, some microbes produce exotoxins that disrupt normal cellular functions. These toxins can increase intracellular Ca-MP levels or inhibit protein synthesis, leading to significant physiological effects. Understanding these mechanisms is crucial for diagnosing and treating infectious diseases. Beta blockers are a class of medications that primarily exert their effects by antagonizing beta-1 adrenergic receptors. This action reduces heart rate and contractility, leading to decreased blood pressure. Clinically, beta blockers are widely used in the management of hypertension, helping to control elevated blood pressure and reduce cardiovascular risk. They are also effective in treating arrhythmias by stabilizing abnormal heart rhythms. Additionally, after a myocardial infarction, beta blockers play a crucial role in improving survival and preventing further cardiac events. ACE inhibitors work by blocking the angiotensin-converting enzyme, which is responsible for converting angiotensin I into angiotensin II. Angiotensin II is a potent vasoconstrictor, so its inhibition leads to lowered blood pressure and reduced strain on the heart. However, ACE inhibitors also prevent the breakdown of bradykinin, a peptide that can accumulate and cause side effects. This accumulation is linked to the development of a persistent dry cough, and in rare cases, angioedema, which is swelling of the deeper layers of the skin and mucous membranes. These side effects are important considerations when prescribing ACE inhibitors to patients. Anticoagulation therapy employs different strategies to prevent blood clot formation. Warfarin works by inhibiting the synthesis of vitamin K-dependent clotting factors, which gradually reduces the blood's ability to clot. In contrast, heparin acts quickly by activating antithrombin 3, a protein that neutralizes several clotting enzymes almost immediately. These distinct mechanisms allow clinicians to tailor treatment based on the urgency and clinical needs of the patient. Understanding how each medication functions is crucial for effective and safe management of anticoagulation. Glycolysis is a fundamental metabolic pathway that occurs in the cytosol of cells. Through a series of enzymatic reactions, glucose is broken down into pyruvate, yielding a net gain of 2 ATP molecules and 2 NADH molecules per glucose molecule. The process is tightly regulated, with phosphofructokinase 1 acting as a key control point to ensure energy production matches cellular demand. This regulation helps maintain balance in energy metabolism, allowing cells to efficiently respond to changes in their environment. Glycolysis serves as the initial step in cellular respiration, providing essential energy and metabolic intermediates. Hormonal regulation plays a crucial role in maintaining metabolic balance within the body. Insulin, released after eating, encourages anabolic processes such as glucose uptake, glycogen synthesis, and fat storage, helping cells build and store energy. In contrast, during fasting, glucagon becomes dominant, triggering catabolic pathways that break down stored glycogen and fat to release glucose and energy. This dynamic interplay between insulin and glucagon ensures that the body adapts efficiently to changing energy demands and maintains stable blood sugar levels. Together, these hormones coordinate the shift between energy storage and energy mobilization. Tissue necrosis presents in several classic patterns, each with distinct characteristics. Coagulative necrosis is commonly observed in solid organs such as the heart and kidneys, where cell architecture is preserved despite cell death. In contrast, liquefactive necrosis occurs primarily in the brain, resulting in a soft, liquid mass due to enzymatic digestion of tissue. Caseous necrosis, often associated with tuberculosis, features a cheese-like appearance and combines elements of both coagulative and liquefactive necrosis. Recognizing these patterns is essential for accurate diagnosis and understanding the underlying disease processes. Chronic inflammation often leads to significant changes within affected tissues. One of the primary outcomes is the development of fibrosis, which involves the excessive accumulation of connective tissue. This process can disrupt the normal architecture of organs, impairing their function. Over time, the persistent inflammatory response may cause irreversible damage, making it difficult for tissues to recover fully. Such alterations can contribute to the progression of various chronic diseases and impact overall health. Let's quickly review some essential clinical associations. The Babinski sign is a classic indicator of upper motor neuron lesions, often observed during neurological examinations. Troponin serves as a highly specific marker for myocardial infarction, helping clinicians diagnose heart attacks accurately. ACE inhibitors, somatostatin, commonly used to manage hypertension and heart failure, can cause side effects such as cough and angioedema. Recognizing these associations is crucial for effective patient care and timely intervention. G6PD deficiency is a genetic disorder that increases susceptibility to hemolysis, particularly after exposure to certain medications, infections, or foods like fava beans. Nephrotic syndrome is characterized by heavy proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Beta blockers work by blocking the effects of adrenaline on the heart, resulting in decreased heart rate, reduced blood pressure, and lowered cardiac output. They are commonly used to manage hypertension, arrhythmias, and angina. Understanding these conditions and their physiological impacts is crucial for effective clinical management.